Now starting, all attendees are in listen-only mode.
Good evening, this is Dr. McSherry. It's February 24th, 2014 at 8:02 p.m. This is Dr. Wall's OBGYN Board Prep 2014 Caseless Software Activation Demonstration Webinar. This is part of the webinar series Monday night, second webinar about how to put the caseless together without any flaws or red flags. Tonight we're going to demonstrate how to activate your software, where to find the software. We are not going to be demonstrating ExamPro's software. Their software is available on their website. If you have an Mac or a Mac computer or an Apple computer, ABOG software is not compatible with Apple, so you may want to consider using ExamPro software. Dr. Wall personally does not endorse his product only because it's not the ExamPro boards you're taking. Unfortunately, you're taking the ABOG board, so they sell a software for a reason. A lot of people find the ABOG software to be a little bit difficult to put together a case list only because they don't have any spell checks, and you have to do your own editing and spell check, whereas ExamPro software does have a spell check. It's up to you what you want to use. I don't mind. Either one is appropriate as long as you understand how to enter your cases appropriately. Their software on ExamPro may prompt you to put in things that are unnecessary, and that's why I think Dr. Wall really doesn't endorse that product. However, ABOG software, you pretty much add anything that you would like to put in the boxes and columns, and we will show you tonight exactly how to do all that. So I'm going to go ahead with my little caseless preparation. I went through some of the steps on the ABOG website and put in a PowerPoint for you. And I will demonstrate, from the website how to download the software and all the steps. Okay, so tonight's caseless software tutorial, you can purchase the software from www.abog.com. The cost is $75. I actually purchased it today. You can purchase. I actually purchased it with Dr. Wall's. Even though he's doing the MOC, anybody can actually buy the software from ABOG if you are a member of ABOG. So it was easy for me to purchase it through him because he's got a credit card and everything through it. So it was click, 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 and I was done. Need for activation code to print. This will be emailed to you directly for ABOG. So once you download the software and you put up the program, and I will show you where you need to put the activation code, they will actually email the activation code to you. Your caseless ID number will not be submitted or given to you from the board until after you submit your application, and then that will be given to you, and then you will send your case list in the end of July. You also want to download Primo PDF, and this will enable you to email case lists for review on the webinar. I will show you also how to do that tonight at the end of my little presentation. That's important because if you enter in 5 cases and you want your case list review on the webinar next week, say for instance as a sample to show candidates what you've been doing, boy, that's going to help me out a lot. The more samples of case lists I have, the easier it is for me to demonstrate where the errors are, and this will give you a good step on how to put your cases in and list your cases appropriately. So download this Primo PDF. I'll show you how to upload your case list and how to print it out with a PDF file so you can email it. Okay, so I actually I took this from ABOG and from their little list, and I just cut and pasted and put it in here. So I'll just read through it. It doesn't hurt if somebody else reads for it. So from the Windows Start menu, you're going to select Programs, and I will show that to you. You'll select Caseless Software, and then select Caseless 2014. I'll show it. I put it actually on my desktop, so it's easier. You may want to dump it into desktop or whatever file that is more visible to you. I find that if you put in documents, some things can get lost. So I like putting everything on the desktop. It's easier to find. The caseless screen will appear. If you have not activated the software, all fields in the screen will be blank. You need to activate it. It's very important. So to activate the software, you need to add the A button. I will show you that. You want to enter your ABOG ID number. And as you know, I'll show you Dr. Wall's ABOG ID number. I have my ABOG ID number too, but I thought it was easier to use his. Activation key, of course, is going to be supplied with your software and emailed to you. Now, in the past, ABOG emailed you a disk, and that's the way I did it back in the day. But now they just upload it right onto your computer. It's very, very easily and very quick. The caseless ID number will be sent to you upon approval of your application. If your application is not approved, of course, your ID number will not be sent to you. So fill out your applications now and get them into the board as soon as possible. You need to get your picture taken, fill out all your paperwork, get it all done, and get your application out the sooner the better. You don't have to pay all those stupid late fees. Of course, and if you wish to exit, you want to click the X button, and I'll show you all that. Okay, so this is what the initial screen looks like after you download the software. Here you're going to be putting your ABOG ID number. I'll use a pen. This is your ABOG ID number, and you want to type that in here. Your activation key, of course, in order to print out your case list, you need to add the activation key number that the board gives you. If you put the key in and it doesn't work, you need to call ABOG right away and find out what's going on. I've seen cases where candidates purchase the software twice and they sent 2 different activation keys, so don't do that. Don't get very nervous and try buying it right away if you don't get the email back from them. I have experience with this because I've done this, so just past experience. I was so nervous when I visually did this. Social Security number is going to be whatever your Social Security was or tax ID number. Your caseless ID number, you're going to add that upon approval of your caseless. And after your application is sent in, the board will send that back to you. To find that ID number, it's going to be on the very bottom of the letter the board sends you. You won't even see it. There's people that forget to put that ID number, and you don't want to do that. You want to put it in. It's very important for you to get that ID number, because if you don't put that in for some reason, the board won't take your application. Type in your first name, your middle name, and your last name. If you're like George John Jr., the 4th, or Junior, or Senior, that's the suffix you want to put in. You don't want to put MD or DO here. You just want to put, if you're Thurston Howell the 3rd, then you can put the 3rd here, or the 2nd. If you're a junior or a senior, put that in here, but you don't need to put MD or DO here. Your address, address where you want your application mailed, your home address, your office address. I think it's probably better that you send it home to your house, unless you want your office staff to get into your results. It's up to you what you want to do. City, zip and zip, city, state and zip, that's count. USA is, of course, your country. There's people that actually have an address. They're in the Middle East, and they submit their case list from the Middle East sometimes. I've seen that also. Okay, so your caseless ID number, again, remember, will be sent to you upon approval of your application. Remember, your caseless ID number is going to be hidden on the bottom of that letter that will be emailed to you from the board. Okay, let's get rid of that handwriting here. Okay, so the first thing you're going to do is, after you enter all your information, you're going to add the hospitals where you practice. By the way, at the end of this PowerPoint, I just got a text on my email on my cell phone. At the end of this presentation, I will take questions from people if we have a little bit of time. If you don't get your question, you can, of course, email me and ask me or text me after the presentation. I will send this PowerPoint presentation out to everybody. Okay, so to do this, click Hospital, and I'll show you the Hospital button. Hospital screen will appear. You want to add hospital and click the A button or Add button. Enter the hospital abbreviation, the hospital name, address, and number of Doppler exams, uncomplicated deliveries performed at the hospital. So if you do Doppler, say for instance you're at MFM and you're putting your case list together, you know, go ahead and add the Doppler studies that you do. A lot of people put 0 for this, for Dopplers, just so you know. I have never seen anybody actually add. I put the 0 for this, unless you do them and charge for them and read them. If you're doing Doppler studies, say on IUGR patients or Doppler exams, ultrasound, DVT, you know, add it. If you don't do them, then don't put it. Now, uncomplicated deliveries, you want to add the number of uncomplicated deliveries you do for that hospital. So what's an example of an uncomplicated delivery? An uncomplicated delivery is a patient that was admitted to the hospital, she delivered, and was discharged home. We've all had these patients. These are the primates that come in, no Pitocin. Maybe they did have an epidural or some Demerol. That's not a complication. Maybe you had to use a vacuum because of She was, maternal exhaustion. I believe vacuums in the past were put under uncomplicated deliveries, but now I think there is a section for operative deliveries. So you don't, all your uncomplicated deliveries, how I remembered it when I did it, is I think the average OBGYN probably has about 70, between 40 and 70 uncomplicated deliveries. Depends how busy your practice is. I mean, the practice I was initially in, I was doing about 15 deliveries a month, and I say probably 3/4 of them were uncomplicated and 1/4 were complicated, where I had to start a PID, or I did a C-section, or they needed Cervidil, or Cytotec, or they had preeclampsia. Those are considered complicated deliveries, and those are going to be entered into your case list. Uncomplicated, again, I'll explain that. It's a patient that was admitted to the hospital, delivered, and then went home with no problems at all. And that's going to be saved as a number. You do not have to enter those into your case list. After you do all this, you want to click the Save button and then repeat steps 3 through 5 for all your hospitals. So, for instance, Dr. Wall, I put him as an example. Pretend he's taking the boards. He only admits to one hospital, which is Sanford. And he would deliver all his patients at Sanford. Now, if you're the OBGYN that delivers from different hospitals, you say you go to Sanford, you go to Merit Care, you go to Riverview Medical Center, you do 3 hospitals. You need to add all of those hospitals in. You need to add them all in. Wherever you have admitting privileges, please put them in. And then click Exit to return to the case list collection screen. Now I'll go ahead and I'll show you what the next step is. Go ahead and get rid of this. Okay, this is your hospitals, and like I just described, the hospital ID number, abbreviation, I just put the first initials of the hospital ID will be A, B, C, or D. It's like if, say, for instance, Sanford, the board does that. That comes with the board. You don't have to put A, B, or C. It just happens to do that. Hospital name, say Sanford. I'll show you again when we do the software. Address of the hospital, city, state, and zip. Again, gynecological ultrasound and Doppler exams. If you do Dopplers for DVT, or any kind of Dopplers, GYN, Dopplers on the ovaries, and you actually do the Doppler, you read it, you charge for it, and you dictate a report, then you want to add that as one procedure. If you do a lot of them, you want to add how many you did during the course of the year. If you don't do them, don't put them, put a 0 there. Obstetrical ultrasounds, Doppler exam, it's been my experience in the past that most candidates put 0 for this. Unless you're an MFM and you're doing ultrasounds, you're reading them, you're dictating a report, you're not relying on somebody else to do an ultrasound, you're solely responsible for the ultrasounds in your clinic, and you have an ultrasound tech and they're doing them, but you're reading the ultrasounds, maybe you want to go ahead and add that there. Uncomplicated spontaneous delivery, that's the number of deliveries you did at that hospital. Again, patient comes in, she delivers, and then she gets discharged home. You may have 20, 30 of those. You may have, say you did 120 deliveries, you may have 30 of those, and the rest of the cases would be complicated deliveries. So again, this is going to come up as you type these in, and then you're going to hit Add to that. Okay, now for GYN cases, from the case list collection screen, click the GYN case button. If we have time, we'll go ahead and demonstrate that all tonight. The GYN cases screen will appear. To add a GYN case, you're going to click the Add button, and then you're going to select what type of case this case belongs to, from June 2013 to June 2014. This is default. If you know the category number, you may type it in the first category field. Otherwise, you may select the category drop down. See, when I put my cases in, I just went from one from the other. So I will show you that, how I did it. If you know the hospital ID number or hospital number, you may type it in the first in the hospital ID. Otherwise, you may select the hospital and drop down the hospital field. Enter the patient's initials, hospital ID number. For instance, their hospital medical record number is their ID number. Age, gravida, para, diagnosis, treatment, or surgical pathology. Now, I did get a text regarding hospital ID number. If your hospital has an ID number for that patient, you can go ahead and just add that in. If it's a medical record number, you put that in. And then again, the corresponding things you want to add, gravity, parity, diagnosis, treatment, and so on, and I'll demonstrate that again. Okay, here's your GYN cases. Make sure you click on when you collected your cases here. It's July 2013 to June. That's the majority of you. The category, see, when you click on this up here, what's going to drop down is all the different categories of things that you could submit into your case list. So, for instance, say it's hysterectomies, and I'll probably demonstrate that tonight. I'll try to demonstrate one at least on each one. So demonstrate for hysterectomies, it'll say abdominal hysterectomies. Hospital ID, it'll come up what hospital is, either A, B, C, or D. And then initials of the patient. Say, for instance, her initials are SK, Samantha Kuchner, whatever her name is. You want to put down her ID number, patient ID number, whether it's a medical record number or an ID number associated with that patient, wherever your medical record generates. The age, the gravity, the parity. How many days was she in the middle of the hospital? Just one day would be considered a one-night stay. That's the way I understand it to be. So if the patient was admitted from one day, she was admitted on one day and discharged the next day, she was in for 24 hours, I would say that would be 1 day. If she was admitted and discharged the same day, it would be 0. Diagnosis, preoperative, or admission, let's say it's leiomyoma, chronic pelvic pain. The treatment was a TAH. Surgical pathology showed uterine weight, 320 grams, and I'll demonstrate that tonight. Pathology showed leiomyoma. You could say hyaline degeneration, something extra you could add. Complications, if she had no complications, she didn't have a urinary tract infection, she didn't have a DVT, she didn't have sepsis, you just put none here. Okay, and a lot of patients, what will happen is they'll have none next to them. And so if you transected the ureter, you'd throw it in this column here. And then you're going to go ahead and click Add. So moving on to the next slide. Okay, so to add your obstetrical cases, same thing. From the obstetrical or case list collection screen, click on the OB button. The OB cases screen will appear. To add your cases, you click the Add button. Select with 2013 to 2014 or your category number. Otherwise, you start from the top and you go down, and we'll show you that. As you know your hospital number, you may want to type it in the hospital ID first, say it's A, B, or C. Otherwise, you may select the hospital from the drop-down field. Enter the patient's initials, hospital ID number, age, gravity, parity, and so on and so on and so on. You want to get the baby's weight, the newborn, the APGAR scores, hospitalization length. Remember, the baby's hospital stay and the mom's hospital stay should be the same. Of course, unless the baby was transferred out. And that gets a little bit more complicated, but I'll show you that a little bit later. Obstetrical cases, again, just describing it again. Category, when you click this down up here, again, it's going to drop down and you're going to be able to see all the different categories. Hospital ID, A, B, C, or D, depending on what hospital. You can just click on your hospital. You can type in A and Sanford would just come up, initials of the patient, and so on and so on. You would put days in the hospital, gestational age. Complication, let's make an example here. Let's say she had preterm labor. So PTL, you want to use ABOG listed abbreviations, and that was on the first PowerPoint. You want to put preterm labor or PTL. Let's say she had preterm labor and prom, PTL, prom, and let's say we click this under preterm delivery. Complications, remember, antepartum complications are complications that happened before the patient was fully dilated. So anything from the time she got pregnant till 10 centimeters will go in that column. Complications delivery, after 10 centimeters till after delivery will go in that column there. Sorry about that. Complications for your delivery. So remember, again, complications delivering postpartum is from the time the patient is 10 centimeters till after. So postpartum hemorrhage would go here. If the neonate had to be transferred, that would go in this column. Say, for instance, mom had maternal exhaustion, that would go in here. Operative procedure or treatment. Operative procedure and treatment would be SVD would go here, spontaneous vaginal delivery. Cesarean delivery would go here. Let's say operative delivery would go here. Repair of 4th-degree laceration would go here. Now remember, operative procedures and treatment. Are they asking for medication here? No, they are not. They are asking for operative procedures and treatment. Now, the problem is that different board prep companies will say, put your magnesium sulfate here, put your breathine or terbutaline in here, put your steroids in here. No, you do not need to put that. Of course, treatment would be steroids, but if you do laboratory tests, let me correct myself, laboratory tests or diagnostic procedures do not need to be added into this column. I'm sorry, I'm going to correct myself. Treatments do. For instance, medications, if you're giving the patient intravenous fluid, if she's just an observation, that is a treatment. I want to apologize for that. So, laboratory tests, ultrasounds, NSTs, what else can we put in here? Biophysical profiles do not, only they want operative procedures and or treatment. Okay, so moving over here to prenatal here, weight and perinatal deaths. Now, perinatal death is the definition is a baby dying from delivery, from in utero up until about 22 or 20 weeks, depending on who you read. That is a perinatal death. A baby that's alive after 22 weeks and then dies is an intrauterine fetal demise. So if the mom comes in and she's 18 weeks and the baby dies, that's considered a perinatal death, so you would put yes there. The weight of the baby in grams, and of course how many days the baby was in the hospital. And then you would click add. All right, moving on. Again, office, same thing. We'll demonstrate that. Office practice cases screen will appear. Add your office practice. Click add. Category number. Again, I go in by topics. I'll show you that. Enter the patient's initials. Patient ID number. Age, gravity, para, problem, diagnosis, procedure, treatment, number of visits, and resulting in the corresponding fields. Now, results. They're not asking for the results of the diagnostic procedures. They're asking for the results of the treatment. So, for instance, a patient came in with vaginitis. She was treated with Flagyl. And then her results, vaginitis, symptoms resolved, or symptoms resolved, or symptoms cured, or something to that nature. And we will give you some demonstrations of those kind of entries later on in the presentation. When all the information for this case has been entered, you click the save button. You want to save it every night. If you're going to enter in cases every night, you always want to click your save button. Don't forget to do that, because if your computer shuts down, say you entered 20 cases that night, you were really feeling good about yourself, you had a really good day at work, and you're like, I'm going to go home and enter 20 cases today. This is my cases for the week, and you forget to save it, you want to kick yourself in the head, so don't do that. Always save. Okay, again, office category. You're going to click on up here again. This is a drop down. It's going to drop down with all the different types of cases you can enter. Initials of the patient ID number. Now, if it's an office patient, a lot of times we don't have ID numbers. Candidates put the patient's social security number in there. I've seen that. What's another thing? You can put the patient's birth date, like for instance 12/05/1966. If you don't have an ID associated with your patients in your office. If you generate a billing slip and it has an ID number, maybe you want to throw that in here, you could do that also. Gravity, the para, and then of course, I can't read exactly what that is, but I will come back to that. It's a little blurry. The problem, the diagnostic procedure, oh, that's the initials, I'm sorry. And the treatment and the results. It's a little blurry here. And then of course, as you put them in, they'll come up here on the screen. Of course, you'll click add. Okay, so now to demonstrate printing the case list. From your case list collection screen, you're going to click print. Print selection will appear, print your reports, and then you're going to there's different types of reports you can print. You can print the case list for the American board or print them for yourself. The ones for the board do not have the initials on them. No initials. The ones for you have the initials and the medical record number. See, the American board, because of HIPAA, they need to accept case lists without the patient's information on it. To print the information sheet of the hospital you're going to need to do an affidavit sheet. I'm going to show you that in a second. On the screen that appears, select the type of report you would like to generate, and I'll show you that too. Press the exit button, and then return to print selection screen, and then print what you want to print out. Okay, here's your print selection, and I'll show you that. Candidate review reports, that's the one with the initials. That does not go to the board. Exam copy reports, that's the ones you want to submit to the hospital. And then hospital material, affidavit. An affidavit sheet will be generated with each hospital that you're affiliated with. Okay, each hospital you're affiliated with. And of course you want to take it to medical records, and it's going to have on there how many cases, and you'll have somebody from medical records. Now, I've had a candidate once before who had called me, and she panicked because she changed her case list at the last minute and then submitted it over to medical records to get her affidavit, and the cases didn't match what was on her case list and match what was on her affidavit. And what a big mess. So if you can get it printed off ahead of time, or just have somebody printed who's not going to be a Gestapo and review everything. Sometimes, depending on hospital protocol, they may have to see and review your case list to make sure everything matches, from all your admissions to all your discharges to all the patients you did surgery on. Hopefully that won't happen to you. They may, depends on the girl that's working in medical records, or the male working in medical records. I would just have the administrator just sign it. It's probably the easiest thing. You don't have to go through all that. It's just stressful. Okay, so again, you want to backup restore button every time you submit cases or put cases into your list. You want to click your backup button, and you want to select a location to save your backup files. I put them on my C drive. I think that's probably the easiest thing to do. And then to restore your backup, click the backup restore button. It will appear, and then you can pick your restore button. And when the restore is complete, click the exit button and return to the case list selection screen. And all these instructions, I'll send these to you. You get them with your case list anyway. Okay, here's your affidavit sheet. Here's one of them. I just printed one out to show you Dr. Wall, for instance, he was taking his board. I only put one patient just to show you exactly how you would print out add a case list, a patient case to your GYN list. And then, of course, this is the signature and title. See, attests one patient was admitted. And, of course, one patient should be on your case list. See, now, if you submitted your case list and only one patient was admitted and then you had 25 on your case list, then it wouldn't make sense. So you want to do this after your case list is done, and then have somebody over at medical records sign this real quick, and then your signature. Hopefully they won't review the case list and this together, because it's just a big mess. A lot of times, if you're admitting and transferring to another attending physician who you're working with, or you're working you're in a residency program and residents are taking care, and the patient goes from patient to patient to patient, the patient goes from attending to attending, and you really want to be responsible for that patient that you just delivered, the one that you admitted under your name and you did not care for. Dr. Wall had stated that, do you really need to add that patient to your cases? Probably not. But the board says you should put every single patient you admitted, which I think is a little tedious. All right, well, here's an example of a printout. I added a patient here. I just put in, remember, A would be for Sanford Hospital, and 66666 was the medical record number, and patient's initial were Diane Moore. And she's 32 years old. She's a 2-1. She was admitted with leiomyoma and pelvic pain. We did a total vaginal hysterectomy on her. Her uterine weight was 78 grams. Now, that's a little small, but I just for, showing you how to enter things. And then leiomyoma. This patient had no complications. Now, if she had a blood transfusion, you would put transfusion here. And then, of course, you just keep on adding things in. Okay, so that's pretty much it for this. I'm going to go ahead and close this out, and I will go to here. Okay, so to get the caseless software, again, you want to go to, of course, you're going to log in with your ABOG identification number, And if you go to here, you do your ABOG ID number and password. In order to purchase the software, you need to do this. So if you're not a member of ABOG, you should be in order to take the boards. Then I think you couldn't be able to take the board to begin with anyway, so you got to be a member of ABOG, obviously. All right, so downloads, we'll go back there. Okay, so this is what you want to download here. Case listen, I don't want to click on it because it'll just take me in. All right, so there you know where to download it. Okay, so once that's all taken care of, you want to go to the software, and I've downloaded the software already. And here's that screen I was talking to you about. Here's your ABOG identification. That's Dr. Walls. Here's his activation key I put in here. His caseless ID number, again, is sent to you upon approval of your application. Your social security number, of course, you want to stick that in here, tax ID number. Your Dr. Walls' name. He's a junior, so I would put junior here. I could probably edit this, but I'm not going to click on it. 1613 Jamaica Drive, Key West, Florida, 33040, country USA. I've entered one GYN case, for example, here. So what we can do here is go to hospitals. Okay, remember I told you about the hospitals? Here's hospital ID number 1. I thought they put A, B, and C, but I guess I just put 1. Hospital ID number is 1. If you put another hospital, it'll be hospital ID number 2. If you put a third hospital, it'll be 3, and so on. Hospital name Sanford Health. I just put abbreviation TRF because that's Thief River Falls, where the hospital is. If you go to different cities, you could do that, or just put a nickname for the hospital. 1720 Highway 59 Southeast. Your abbreviation will come out down here. Thief River Falls, Minnesota. Again, if you did any GYN ultrasounds or Doppler exams at this hospital, you want to add them here. Your OB ultrasounds and Dopplers, again, add here. And then uncomplicated spontaneous deliveries you want to add here. Okay? And total cases and uncomplicated deliveries is just 1 because I just added 1 case so far. So they would enter both of these. Okay, so I'm going to exit here, or yeah, I'll exit because we did all that information already. Now, if I was going to add another hospital, of course this would come up, and you would do hospital ID number, probably number 2. You could do that, and then put the hospital name and so on. So I'll revert back. You hit revert if you want to go back. Okay, so let's finish here and exit here. Go back to our main screen. Again, backup restore, I talked to you a little bit about that. Let's go to GYN cases. Okay, here's the hysterectomy. Remember you said I click on here? Oh, let me put edit. Here's all your different topics for your case lists. There's a lot of them, isn't there? Tons and tons. Okay, somebody asked me a question. I'm going to pull it up. All my friends who took the boards last year used ExamPro software. Do you have anything against it? I already purchased it months ago, and I'm already started using it. That's fine. I have nothing against it. I mean, a lot of people do use it because it's Mac compatible and Mac friendly. So the only thing I'm concerned about with ExamPro is they prompt you to put unnecessary information into your cases. So be careful with their prompts. Okay, so let's go back to this abdominal example, hysterectomy I threw in here. She had her surgery at Sanford Health. I put her Diane Moore as her name. Here's her fake medical or patient ID number. Her age was 32. She gravitated to para when I added this in here. Days in the hospital, she was 3. You always want to capitalize when you're adding things into your case. You always want to capitalize the very first letter here. See where I put capital L, capital B? Another thing ExamPro tells you to do is bullet these. And Dr. Wall does not like when you put like a little bullet or a star here next to things like this. It kind of makes your cases look a little bit busier. So we like it nice and clean and simple to the point. Here, treatment. If the patient had a total vaginal hysterectomy, and let's say after the surgery she developed sepsis, you probably want to put the antibiotic here, put antibiotics, and then under complications you would put sepsis here instead of none. I'm just talking about when you would add a second treatment here. So her treatment was a total vaginal hysterectomy, surgical pathology, here's your uterine weight and leiomyoma, Complications, but okay, none. So if she had sepsis and we put her on antibiotics, we'd put that there. So let's get rid of the pen and erase all our drawings. And normal screen, revert. Okay, now let's go ahead and add another case, just for the giggles of it. All right, so let's do a laparoscopy. Let's say we have our big pile of things that we did. We went to medical records. We tell them to pull all our cases we did in GYN, all our surgeries. We tell them to pull the operative report, the pathology report, and the discharge summary. That's all you need from medical records. You take them and you staple them together. You get that pile. You go to medical records. You say, hey, I need all my OB cases. So tell them to print out all your OB cases. You need the Hollister, the delivery summary, because it's going to tell you the baby's weight and how many days it was in the hospital, and the APGARs. You need that, or whatever your summary is at your hospital, your delivery note, your operative note if you did a CD, and your admission history and physical, so you know why the patient was admitted, and also if it was a complicated discharge summary. Staple all those together and keep that. That's one case. And then for your office list, I have a little interesting way of doing those, and I'll show you in just a second. Okay, so let's say we have our big pile of papers next to me, and I'm going to say, oh, here's another one. Pull it off. Oh, no. Mary Jones, she had a laparoscopy, so she had a diagnostic laparoscopy. Let's put her in here. All right, so Mary had it at Sanford Health. Her initials was Mary Jones. Her ID number, she's a 3333333. Okay. Let me put 6 threes here. Her age, Mary's young. She's 27. You don't see that many Marys at 27 years of age anymore. Make her Melissa. Her gravity, she's gravida 1, para 0. Let's say she had a TOP back when she was in her 20s, early 20s. Days in hospital, just 0. Remember, she had a laparoscopy. She was discharged home the same day. Let's say she comes in, and the reason why we scoped her on our operative report said pelvic pain. And let's say the ultrasound report showed a 3-centimeter cystic mass. So let's put ovarian. Remember, I said always say capital. Ovarian. Yeah, not good. Cyst, small c. And I'll put 4, or no, let's put 2 centimeters. Okay, this was found from our ultrasound. And the reason why we're doing the scope is because she's got pelvic pain, ovarian cyst. We probably treated her with oral contraceptives and gave her an NSAID. She probably never got better. And we said, yep, let's do a scope on you, Mary or Melissa. Treatment. Well, the treatment technically with her, we didn't treat her or anything, but we did do a diagnostic laparoscopy on her. So let's add this in here. And it's under that category. Okay. And we just looked. There was nothing there. Surgical pathology. Well, Mary didn't have, or Melissa didn't have any pathology on this case because we kind of went in, we looked to see what was going on. We saw a cyst on the ultrasound. We weren't really sure what it is. It could have been a dermoid, but we weren't sure. We had to scope this girl. She wasn't getting better with just OCPs and NSAIDs. So pathology, we can put normal pelvis. Now, let's say you saw adhesions here. Let's put pelvic adhesive disease. And let's say there was a corpus luteum on the left. That's what else we saw. I don't know if that's spelled right, but no, sorry about that. On the left, luteal. Okay. And then complications, we'll say none. Now remember, you have no pathology. You need to document what you visualized on the scope, okay, and what your final diagnosis was. So it could be your final diagnosis was pelvic adhesive disease because that's what you found on the scope. Okay, so we hit save. Looks good here, right? 2710. She was in the hospital 0. She went home. Complications? None. Now, let's say we sliced her ureter during this case. Now, we just did a diagnostic scope. So if we did unfortunately cut her ureter for unknown reason. It probably was an operative laparoscopy, so it would be under a different category. So, but you want to add your complications here. So save. And there we go. Here's our next case. Let's move on here. Let's go to OB cases. Okay, now I didn't add any OB cases here, but for the sake, oh, another question. Okay, let's say you performed a robotic hysterectomy and the patient was discharged without any complications. However, she was readmitted 6 days later for a pelvic infection. Now, there is a category for that, guys, so you will see that in all of your different categories. Would you put pelvic infection under complications? Absolutely, you could that, even though it was not part of the initial hospital course. Well, this could be this could be a readmission for complication. I think there's a category for that. For clarification, surgical, pathology, intraoperative findings. Yes, pathology equals intraoperative findings. That's correct. And I'm going to put yes here just to answer your question. Typing. Okay. It's not typing for some unknown reason. If this was a TH, would you include both intraoperative findings and adhesions as well? No, just the path reports. Just the path reports. Now, if you did adhesionolysis with the TH, you would add that under treatment. You would add that under treatment. Okay, so OB cases. Oh, we have to add. Sorry about that. Okay, so let's say, let's do a breach. That's something easy. We get our OB pile out here. And, here's the pile of papers. Okay, oh, first case. Gee, I had to do a CD for a breach. Damn. Oh, what a bad case. That patient was not a fun patient. Boy, and she didn't want that version. It was a big mess. My partner had to take over this case. God, I remember it like it was last week. Okay, Sanford Health. That was the hospital I did it at. It says right here, Sanford. Okay. And her name is Clarice Jones. And patient ID number is 111, whatever it is. Clarice is 21. This is her first baby. So it's gravida 1. Oh, not gravida 10. I'm sorry about that. Let's get rid of that. That's an oopsie. So gravida 1. Now, you don't go gravida 1, para 1. You gravida 1, para 0 because this is before the fact. Gestational age, Clarice was 39 weeks. She came in labor. Okay. Days in the hospital. She was in, our hospital keeps them for 3. So we'll put a 3 here. Usually just hit tab, but it's actually a little crazy here. Okay, complications. Let's put breech presentation. You can just put breech too. Okay, let's put active labor. Let's make that fun. Although I didn't say that, I thought it would just make it a little more interesting. Let's say poor Clarice. She was positive. She was GBS positive. Oh, and you know what else with Clarice? She came in ruptured. And she ruptured at home, and then she was in labor when she came in. So we could put, or whatever the scenario is. I'm just trying to give you a little story here. Complications, delivery or post-op. You know, Clarice didn't have any problems. She came in, she was in labor, her membranes were ruptured. What else? She was positive for GBS at 36 weeks. Since we're going to go ahead and section her, we're probably not going to give her antibiotics, but we're going to give her preoperative antibiotics because she's having a C-section. So complications, delivery, or postpartum. Let's say the baby had respiratory distress and had to be transferred. It should be a small d. I'm not such a good typer, guys. Hang in there. Respiratory distress, maternal, neonatal transfer. Boy, this poor baby had a tough time. Okay, operative procedure. Primary CD. You can put antibiotics. Okay. And what else could we put here? What else did we do for her? We really did not do anything else, do you think? No, probably not. She had to labor breech. You could put in here, maybe say, for instance, you offered her a version at 36 weeks and she declined. You could put declined version here because they're going to ask. But see, this patient's an indicated delivery because, unfortunately, She's in labor and she's breech. So if she was advanced cervical dilatation, you could be active labor 4 centimeters or active labor 6 centimeters, whatever curve you're using now. Okay, so perinatal death, this is a no, because the baby didn't die. And then the weight of the baby, let's say 3,600 grams, 102 grams. And the APGARs, let's see, 8 and 9. Days in hospital, 3. Okay, save. There's your case. There's your case. How about that? Okay, another question. Do we have to list the specific antibiotics? No, just put antibiotics, guys. Do not put the specific antibiotics. Be non-specific here because you want those level 1 questions. Magnesium sulfate, put seizure prophylaxis. Cytotec, put induction. You don't have to put cytotec, just put induction. Say you use Cervidil, just put induction. Let's see another one. Let's say you use Methergen. Put uterotonics. Let's say you use magnesium sulfate for preterm labor. Say tocolysis. How about you use magnesium sulfate for neuroprotection? You could put magnesium sulfate for neuroprotection, or you could use a neuroprotective agent. And they're going to ask you, you want to elicit as many level 1 questions as possible. Level 1 questions. That's the key. Level 1. More level 1 questions, the better, because you're in there for 3 hours, and the simple questions, you want those because you want to eat that time up. That's just a little secret. That's a Dr. McSherry secret. Okay, so we added that. So let's exit real quick, and let's see what we made here. And then office cases, again, it would be the same thing. Problem. Let's put throw one in here just for giggles again. Okay, so we had to add. Let's do an easy one. Let's preventative care and health maintenance because it's number 1. Okay, I just saw this patient last week in the office. I just decided to do my office list now. I don't feel like going through all my office. I know I can get 40 office cases very easy. I can pick, there's over 40 categories here. I could probably put 2 into every other one. It's probably really easy. Only 40 cases you want to do here. Only 40 cases. So you got 2 preventative health, 2 smoking, 2 contraception, 1 IUD, 1 birth control pills, counseling. I don't want to use that one. Primary, you have a lady that came in that was 16 who had Turner's and you diagnosed it. I mean, that's wild. Put her in there. You have a lady with secondary amenorrhea that was pregnant. Throw her in here too. Endometriosis. She's a young girl. Endometriosis. You diagnosed her. Put her in. Another lady came to you. You've been seeing, your partner saw her. She's been treated with a GnRH agonist. You happen to see her for 1 visit. Throw her in here. Saw her a couple times. Office surgery. Oh, you took off a skin tag. Throw that in here. A leap. Throw it in. A IUD insertion. Put it in. Office surgery. Let's say she had a little polyp on her cervix. So there you go, another one. Anything you do in the office, any fun thing you do in the office, say you stitched up somebody's cut finger. Hey, throw it in there. A vaginal laceration or a little tear or a stitch came out in an episiotomy and you wanted to repair it in the office, throw it in there. Abnormal uterine bleeding, that's an easy one to find cases for. Vulvar disease, vaginal disease, easy, breast disease, fibroadenoma, throw it in there. Immunizations, really simple. That's an MMR vaccine or even a young girl that comes in for HPV with her mom. Sexual assaults are hard to find unless you see them a lot in your own. Pediatric gyne. This is a girl that hasn't had her period yet. She hasn't menstruated, and she comes in with vaginal itching. Oh, terrible. Okay, ultrasound. If you're comfortable with ultrasound and you don't mind putting cases on that, go for it. Benign pelvic masses, that's the young girl that comes in with a 2-centimeter cyst. Family practice saw her. She was referred over to you. She had a 2-centimeter cyst. You followed her in the office. You gave her some birth control pills or you gave her NSAIDs. You followed her back up. Ultrasound was negative, and she's on your case list now. Substance abuse. Hey, you got that lady that comes in and she had that pelvic pain and she keeps on coming in for those hydrocodone. Throw her in here. Hey, or you found somebody that had a drinking problem and you counseled them. It wouldn't be hurt. Hey, obesity. A young girl that comes in, and maybe she's in her 20s or 30s. She's getting ready to go to her family reunion. She wants to lose 10 pounds, and you give her some diet tips and tell her what her BMI should be. Throw her in here. You can find 20 cases, 40 cases really easy. So what I did is I just started from the beginning, January, and then every time I was in the office during that week, I found 4 cases. And I just put them in at the end of the week. I have it on my laptop. I brought my laptop to work with me. And at the end of the day, or during lunchtime, I would force myself to put 2 cases in. And that's what you do, and you can get this done pretty quick. Okay, so uncategorized cases, anything that's not listed here. But you only need 40 cases, guys. Okay, so initials. FG, I don't know why I just want to put that. Oh, medical record number, or Social Security or date of birth. Let's see her date of birth is 66. Put her 47. Oh, sorry about that. We're running out of time already. Isn't that crazy? This is getting so much fun. I'm just getting warmed up now, guys. Let's see. She says an annual visit. She's the first time she's come to your office. She's a new patient, so let me get that in here. That's one. Yeah, it does that. It clicks like that. Just put annual visit. Maybe she needs a refill of her birth control pills or refill of her hormonal pills. So, OCP, oral contraceptives refill, or whatever the problem is. Diagnostic procedures, you want to put down age-appropriate diagnostic screening. Now, in the bulletin, I have to admit, it says to put each individual test. But, as a rule, people in the past that have worked with us have been very general on this. So do you need to put each specific test? I wouldn't do it. And you know why I say that? Because during the course of the year, you are going to learn that a lot of times when you add stuff in the initial part of the year, in the beginning part of the year, when you're putting this case list in, you're going to find that, oh my goodness, I made a mistake. I should have added DHEAS when I was working this patient up for hirsutism, and I forgot to put it in here. You know what you put? You just put diagnostic tests. Don't put routine, just put diagnostic tests. Let the board ask you what tests you ordered. That's part of your exam. Okay? Age-appropriate diagnostic. Let them ask you what this is. And then you can tell what labs you do on a 47-year-old. You're going to do a glucose. You're going to do a lipid profile, right? You're also going to do a mammogram on this young lady. What else are you going to order on her? You can do pap smear if she hasn't had a pap smear in a while. Okay, diagnostic, that's all we're going to do on her. And treatment, let's say none, or we can just put counseling. Some people do that. Some people put none. I spelled that wrong. Counseling. Sorry about that. See how typos? Okay, and then result. You want to put, now here you can put your diagnostic screening only in preventative care, geriatrics, and genetics. You can actually put your results in the results column. So here I'm going to put normal results. Now, if this was a different case, say it was pediatric gynecology, and the child, this is supposed to be annual exam, guys, sorry. I could change that. This is what that case was. Okay, let's say it was a pediatric gyne case or smoking cessation, and she came in for an annual, but you want to put her on her smoking diagnostic, which she came in for, say, Chantix. You could put in here diagnostic procedure, and she's not here, she just wants to quit smoking. Or you could put, if you don't order any tests on her, you can put none. I mean, are we going to order any laboratory tests on this patient? Probably not. She's coming in for Chantix, unless she's got a lipid problem. You're following her for that. Treatment, again, for this patient, it would be Chantix or anti-nicotinic receptor blocking agent. Okay, you can put that there. I'm going to be specific. And then results, smoking cessation. She said she quit. Okay, another question. I'm actually going to stop here tonight, but what I will do is next Monday I will continue with talking about this. I need to show you how to convert your list to PDF file, and maybe I can demonstrate that real quick. Okay, let's say, for instance, we're going to print out our cases, and we have a candidate review report, and I'm going to remember we just added some GYN cases, so I'm going to put the GYN in there, and I'm going to print out my 12-month. and I just want to put it to printer. Okay, and let's say generate. Now, I already downloaded the PDF, Primo PDF. So if I wanted to convert this to a PDF and throw it up on my desktop, if I just hit OK here, it's going to print. Now, if I click on here, see this is Primo PDF? This is going to convert it to a PDF file. So watch me do this. Okay, create PDF, and I'll save it on my desktop. Okay, overwrite. There it is! Woohoo! Okay, now this is a document I can save. I can save it to my desktop. This is my GYN case list, and I can save it and then email it to me. Email it to Dr. McSherry for review on the next webinar. Okay, well, we're going to stop here for tonight. I showed you the PDF software. I showed you the beginning of the software review. I still have a couple of things else I want to show you as far as putting different cases in to your case list. I want to show you a couple more things. So again, let's go ahead and go through the questions here. Do we know antibiotics we just talked about? For substance abuse, can we use OB patients or do they have to be GYN only? They can be either or. They can be an OB patient. That's fine. I mean, just think about it. MFMs, they got to do their OB list and their office list right from their MFM patients. So they can be OB or GYN. That's fine. You can have a pregnant patient at 6 weeks who's found that she's smoking marijuana. For ultrasonography, does this include OB ultrasounds for dating? If you're dictating an ultrasound and you're dictating the BPP report and you're not relying on anybody else and you're charging for it, yes, you're going to put it on there that you did it. If you're not charging for it and you're doing a quickie ultrasound and see breach or vertex, yeah, you're supposed to record all your if you are charging for a diagnostic test and you're doing it and you're dictating a report and you're charging for it, you've got to put it in that little box there. You've got to put it in that little box. Okay? All right. I'm going to stop here for tonight. This was an excellent webinar. I went through the software. I introduced you to it. Again, we do not demonstrate Exam Pro software. You can go to one of their courses and fly there and sit in his whole day of his case list review, or you can learn it here right online with me. This is really easy. Part 2 of our case list review will be next week. I'm going to go a little bit more of a demonstration of how to add the OB cases and the office cases, and we can do some samples. If somebody wants to start entering some cases and download Primo PDF and PDF it and send it off to me, hey, we'll do a little review next week on and critique somebody else's case list tomorrow. Okay, this is a successful webinar. This is Dr. McSherry concluding tonight's webinar. It is 9 p.m. on February 24th, 2014. This was the introduction to case list entry and case list software by ABOG. I will see everybody next week back for case list review, and then for tomorrow night for our lecture on abnormal uterine bleeding with Dr. Ann Doe. Take care and have a good night. I was glad you were all here listening. Great. See you. Have a good night.